So as we had studied about stroke yesterday, okay, whenever stroke word comes, think that there is some disturbance of blood supply to the brain. Either वहां पे clot हुआ है और वहां पे temporary clot है. Either there is a permanent clot or there is a temporary clot or there is some kind of rupture in the blood vessel and there is extra blood there. So what will be the symptoms? How one will know that a person has got stroke? So there is a short form of this. People use it in West also. Fast. Okay. In stroke, act fast. Fast. Fast means the face. Ask the person to smile, but the person will be drooping face. उनका face लटका हुआ रहेगा, वो मुस्कुरा नहीं पाएंगे, हंस नहीं पाएंगे. Then A is ask their arms will be feeling weakness. उनकी हाथों में weakness होगी. First it will attack your arms and then it attacks legs usually. So ask that person to raise the arm little bit up. If he or she is not able to raise it, the alarm bell should like go on. Then ask them to speak something. They will not be able to speak properly. The speech will be slurred. Then in time, save time. That is what T stands for. So save time, just rush them to the nearest possible hospital. Don't try to give them self-care or care at home. Don't waste time, because if extra time is wasted, those particular tissues are dead forever, then there will are chances of permanent paralysis. In certain cases, even blindness, hearing loss, breathing difficulties, and even death. So person should act very, very fast. There can also be some vision changes. There can also be headache. It happens in certain cases. In certain cases, it doesn't happen. But generally, this face, arms, and speech issues will be there in every kind of stroke. Symptoms क्या है? Weakness है, paralysis है, numbness है, difficulty speech as we have told, difficulty swallowing, and there will be loss of consciousness in certain cases. Treatment is like we had discussed yesterday. They will give some clot busters, or they might ask to do for surgery, and later on when they are sent to home, they will be given some supplements. They will be asked to have proper hydration, and there will be a rehab program for such people. Risk factors is usually people with high BP, they tend to have this, because in high BP we have seen what happens in our arteries. There is clogging, है ना, वहाँ पे fat जम जाता है. And even high cholesterol, heart diseases, diabetes, because in diabetes your arteries will become hard. So there can be rupture ka chances are high. Even people who tend to have smoking and alcohol, their blood vessels, they become hard with time. They have extra calcium flowing in the blood vessels, and that will harden the arteries and the clots further, which are prone to rupture. ठीक है. Epilepsy also we had yesterday studied. So epilepsy is extra electricity in your head. Okay. And this electricity is getting generated by your nerve cells, motor cells, and sensory cells, which we know. These are two types. Why I included this slide? Because these are two types based on the causes. Cause of epilepsy yesterday we did not discuss. Cause can be the primary kind of epilepsy. People don't know its cause, so it's idiopathic. हमें नहीं पता होता है इसका cause क्या है. Families में genes में run करता है, but we are not sure. Doctors are not sure कि क्यों होता है. Then there are some secondary kind of epilepsy. What happens even in small children, if they get very, very high fever, like 103, 104, at that time, they tend to get epileptic attacks. But that gets sorted out with time. So those kind of things which happens with like symptomatically for a brief period of time, they are known as secondary kind of epilepsy. Like a tumor, like chemical disturbances, like head injury, like certain drugs or alcohol withdrawal, like stroke, like birth injuries. So these all are secondary reasons for epilepsy. They get sorted out when their primary root cause gets sorted out. जब उनका root cause ठीक होता है तो वो epilepsy का episode भी ठीक होता है. लेकिन जो primary epilepsy होती है उसका नहीं पता है उसका reason क्या है और उसको मेडिकेशन, जनरली मेडिकेशन चालू रखनी पड़ती है फॉर लाइफ लॉन्ग. Third is which you should know about Parkinson disease. Remember, it is chronic progressive degeneration. एक ही बार नहीं होती है. Now, anyone can tell me what is difference between chronic and acute?
मैम क्रॉनिक मतलब धीरे धीरे होना, और
acute मतलब
वो एक क्विकली,
जल्दी से होना, और वो
फास्ट.
ठीक होने के चांसेस ज्यादा होते हैं.
जी.
ओके, जैसे मतलब कोई सडनली कोई रीजन हुआ, अभी मैंने जैसे बताया कि किसी को बहुत हाई फीवर हो गया एंड सडनली देयर वाज एन एपिलेप्सी का एपिसोड, सीजर आ गया, दैट इज एन एक्यूट कॉज एंड दैट कैन गेट सॉर्टेड इजीली. वो अचानक होता है, जल्दी होता है, ठीक होने के चांसेस ज्यादा होते हैं. कभी कभी इट स्टेज फॉर लाइफ, बट ठीक होने के चांसेस ज्यादा होते हैं. बट इन केस ऑफ क्रॉनिक डिसऑर्डर्स व्हाट हैपेंस, इट कम्स स्लोली, इट्स प्रोग्रेसिव, ये बढ़ता जाता है विद टाइम, and then the degeneration needs to be stopped by some external medication or intervention, but ये reverse होने के chances बहुत कम होते हैं. ये arrest हो सकता है. arrest मतलब जहां, wherever it is, in whatever stage it is, it can be stopped at that stage, but it will not be, it is not possible to get it reversed completely. So Parkinson disease is one such disease. और पार्किंसन डिजीज में रिमेंबर दैट डोपामाइन गोज लो, and what is the nucleus inside your head which produces dopamine is substantia nigra. ये आ सकता है, नहीं भी आ सकता है, but you should know it. Substantia nigra जो है, nigra जो है, that produces your dopamine, and this you must know that because the dopamine is less in these patients, that creates moment disorders, and even they are gloomy, reward नहीं मिलता उनको, क्योंकि we have seen that dopamine, when we are reading about hypothalamus and neurotransmitters, in that we have seen that dopamine is the hormone, is the neurotransmitter for mood, for rewards, for mood upliftment. तो यहाँ पे उनको रिवॉर्ड फील नहीं होता है, तो these people generally tend to go into depression also. तो इनके सेकेंडरी सिम्टम्स में डिप्रेशन भी हो सकता है. तो रिमेंबर दिस. Then MS, multiple sclerosis. We have read about it. If anyone remembers while discussing about autoimmunity, does anyone remember क्या होता है इसमें? Multiple sclerosis में क्या होता है? Sclerosis में what will happen? What will get attacked? क्या अटैक होगा न्यूरॉन का? Anyone?
मैम अपने उस पे जो अटैक करने के लिए ऐसे
करेक्ट,
कुछ.
ये भी मैंने बोल
हाँ.
दिया. हाँ, ऑटो इम्यूनिटी है, न्यूरॉन में अटैक होगा, बट न्यूरॉन्स का कौन सा पार्ट अटैक होगा?
माइलिन शीथ में.
माइलिन शीथ, वेरी गुड. जो न्यूरॉन्स के ऊपर ये शीथ होती है, हमने पढ़ा था श्वान सेल होता है, उसके ऊपर एक शीथ लगी होती है, पैडी होता है, फैटी पैड होता है. दैट फैटी पैड गेट्स डिस्ट्रप्टेड. बॉडी सोचती है कि ये जो है ये एनिमी है. ऑटो इम्यूनिटी में क्या होता है, बॉडी जो है अपने आप को अटैक करती है, डिफरेंट पार्ट्स को. एंड इन दिस केस, इन दिस डिजीज, बॉडी इज अटैकिंग दिस माइलिन शीथ ओवर द न्यूरॉन्स. तो न्यूरॉन का ये माइलिन शीथ एक्सपोज हो जाएगा, तो करंट प्रॉपरली पास नहीं होगा, है ना. क्योंकि हमने देखा था नोड ऑफ रेनवीर से ऐसे ऐसे करके करंट पास होता है. नोड ऑफ रेनवीर इन दोनों के माइलिन, जो ये श्वान सेल है, इन दोनों के बीच का एरिया है, तो वो डिस्टर्ब हो जाएगा. एंड बिकॉज ऑफ दैट ऑल्सो नर्व का डिजेनरेशन होगा. एंड वेयर एवर इट इज प्रेजेंट इन योर हेड, जिस पोर्शन में होगा, if that portion is connected to vision will get lost. speech में इशू होगा, movement में इशू होगा, learning में इशू होगा, मसल स्टिफनेस उसमें इशू होगा, मेमोरी में प्रॉब्लम होगा. ठीक है, इसका भी ऑटोइम्यूनिटी का वैसे भी कोई कॉज हमें पता नहीं है. It runs in families, it's genetic and generally gets triggered after some stressful episode. या तो बॉडी के हेल्थ वाइज कुछ स्ट्रेस हुआ होगा तो ऑटो इम्यूनिटी ट्रिगर होती है और आ जाती है, या तो बॉडी को फिजिकल नहीं इमोशनल कोई स्ट्रेस होता है. आइदर फिजिकल और इमोशनल स्ट्रेस आफ्टर द एपिसोड ऑफ दैट, आफ्टर दैट एपिसोड ऑफ ट्रॉमा, आइदर फिजिकल ट्रॉमा और इमोशनल ट्रॉमा और मेंटल ट्रॉमा, ऑटो इम्यूनिटी कम्स इनटू पिक्चर. अदरवाइज ये जेनेटिकली होती है, दबी हुई होती है. बट at that time it gets to the surface, and once it gets to the surface, there is high chance that it will remain till entire life. बट देर आर सर्टन रेमिशन एपिसोड्स, कुछ बीच में रेमिशन में चली जाती है ऑटो इम्यूनिटी, बट फिर से क्रॉप अप हो सकती है अगर बॉडी को हम वैसा एनवायरमेंट देंगे। तो इसीलिए इसका कॉज हमें पता नहीं है। तो देयर कैन बी विजन लॉस, मसल वीकनेस हो सकता है, सेंसेशन, स्पीच, इट्स वेरी डेंजरस काइंड ऑफ डिजीज। हेयरिंग लॉस हो सकता है, डिजीनेस होंगे, कॉग्निटिव चेंजेस होंगे, लॉट ऑफ इश्यूज। They prescribe in most of the autoimmunity, they prescribe steroids because steroids will tend to suppress the immune system. Those immune system को as a whole suppress करेंगे. So in autoimmunity, the people who are on steroids, they will also face this problem of getting infections very easily. क्योंकि पूरा ही इम्यून सिस्टम दबा दिया ना, आप जब एक्चुअली कोई एनिमी आएगा, अभी फॉल्स एनिमी तो ठीक है दब जाएगा, बट एक्चुअली इफ सम वायरस और बैक्टीरियल अटैक इज हैपनिंग ऑन दैट बॉडी, at that time that antibiotic and everything they need to take, body will not be able to resist on its own because their natural immune system is being suppressed, completely suppressed. Ideally they should suppress only a particular part of it, which as of now science allopathy is not able to do. Now this is S Vyasa based because in Bihar school book about your epilepsy, stroke, everything is not written in that detail. So I have included certain things, and Parkinson is not mentioned there. So I've included here migraine and tension headaches we had read yesterday. And I had told you that S Vyasa uses head rolling in Shashankasana and all, and even on the wall. हेड को डिफरेंट डिफरेंट पोजीशन में वो रोल करवाते हैं वॉल पे या नीचे मैट पे, जिससे वो बोलते हैं कि टेंशन हेडेक्स एंड माइग्रेन गेट सॉर्टेड आउट. बट इन बिहार स्कूल दे डोंट यूज दिस. Okay, so make a note of it. They don't use this. Then stroke mein, what is required? They are very weak. After they come home, they need rehab. Unko rehab chahiye, stimulation chahiye, because their muscles are all gone. So in this case, what we'll do certain loosening practices, we'll do sukshmayam based on the person's capability and which part is impaired, how it is impaired. We have to be very, very careful. It's like a person-based approach. Generally, हम सबको same practices नहीं दे सकते. Not in any case we should not give, but especially when such kind of issues have happened, then we should be very, very careful. So Sukshmayam, Shakti Vikasaka, back bend, forward bend based on what a person is capable of doing, what part is getting impacted in this case. And many stroke patients, what happens to them, they go into deep period of depression. So depression के time पे we should not give DRT to them. DRT is like deep relaxation technique. It's like योग निंद्रा. तब हम नहीं दे सकते उनको अगर वो बहुत ही डीप डिप्रेशन में गए हैं, क्योंकि या हमने कल ही बात करी है कि डिप्रेशन वालों को हम डीप ध्यान, डीप रिलैक्सेशन, लॉन्गर पीरियड रिलैक्सेशन नहीं देते हैं. ठीक है, so it depends on case to case basis. And Kapalbhati will give if they are able to do Nadi Shuddhi and Brahmari. They are just telling that in initial periods, any stroke patient, please don't give them balancing postures because their balancing is very, very, very weak. So if we want to give at later stages, that has to be given with assistance, not SAE, with wall, with support, with chair. So with proper care, it has to be done. Epilepsy will do, they are saying Trikonasana, side bends, your back bends, your Pavan Muktasana, Setu Bandhasana is very, very good. QRT, DRT is good, Nadi Shuddhi is good. Epilepsy, they say don't do Kapalbhati, but I think Kapalbhati is still okay. I think we should not do Brasvika, we should not do for epilepsy patients. So wherever there is extra activation of your, say your frontal brain, और देर इज हाइपर वेंटिलेशन जहां सांस बिल्कुल बंद हो जाएगी, वैसी प्रैक्टिसेस हमें उनको नहीं देनी चाहिए. वी शुड गिव इट इन लिमिटेशन. इवन डायनेमिक प्रैक्टिसेस आर ओके, बट दे शुड बी ब्रीदिंग प्रॉपर्ली. एंड वी शुड नॉट गिव एपिलेप्टिक पेशेंट त्राटका, ज्योति त्राटका नहीं देना चाहिए उनको. Parkinson's may they need both stimulation and relaxation. Certain parts have become very, very, very rigid, and certain parts, certain muscles have become very, very loose. So we should, for the parts which have become very rigid, we should give loosening practices, Sukshmayama, and the parts which have lost all their muscle tonality, to those parts we should give Shakti Vikasaka practices. We should do chest openers with them because they tend to have kyphosis. Kyphosis मतलब उनका hunchback हो जाता है. तो hunchback अगर हो रहा है जितना, and it will vary from person to person. We should not force things on anyone. At times their age is so much and there is so much of stiffness. Along with Parkinson's, they will have arthritis or osteoporosis. So we should take care of that, that we are not pressing and pushing them. They should be able to do these things as per their capacity. Side bends are okay. Sitting side bends on chairs are okay. Forward bends are okay. QRT, DRT is okay, but DRT again, if they are into depression, we should not give. Parkinson's people generally tend to go into deep depression. Nadi Shuddhi is good. Kapalbhati is good. Balancing postures, again, no, because they are risky. We should give them, but then assisted and depending on person's capability, how his present health, and what other conditions are there along with Parkinson. Multiple sclerosis, we should also give them stimulation and relaxation, same like Parkinson's only, but here stiffness is little less than Parkinson's. यहाँ stiffness उतनी नहीं होती है but Parkinson से थोड़ी कम होती है. And in case of vision defects, remember that in high pressure of eyes, जो ग्लोकोमा कल हमने बात करी थी, don't give trataka to them. Okay. Rest all the relaxation practices, your eye palming, your head neck exercises, even eye practices. Kriyas are very good for vision defects like neti. तो नेति से बहुत हेल्प मिलती है उनको. ये सब is not in your syllabus but still. Now if a question comes to your mind, अभी हम बोल रहे हैं उनको रिहैब देना है, स्ट्रोक वालों को रिहैब देना है, और the person who has been hospitalized recently has faced some stroke, we have to give, or some heart attack, we have to give rehab. So what is rehab? Rehabilitation जो होता है ये वो process है where a person feels that he is again okay physically, emotionally, psychologically, and he is able to maintain a good quality of life. जहां पे उसको थोड़ी satisfaction आए that he is capable of carrying on with the life processes now smoothly. ठीक है, तो वो हम help करते हैं. Rehab doesn't mean complete cure of the problem. So what will we do? We'll work on the muscle strength, we'll work on the range of motion कि इतना range बढ़ जाए, जो उनका अभी था उससे थोड़ा बढ़ जाए, sensations आ जाए body parts में, fatigue should reduce, gait should become properly, gait होता है चाल ठीक हो जाए, mobility उनका हाथ पैर चलने लगे थोड़ा, और quality of life अगर उनके बिल्कुल सेंसेशन नहीं हो रही है वॉशरूम जाने की तो वो सेंसेशन हल्की फुल्की आ जाए, ब्लैडर कंट्रोल हो जाए. बहुत केसेस में स्ट्रोक में ब्लैडर कंट्रोल नहीं होता है, तो वो सब चीजें थोड़ी ओके हो जाए. अब स्ट्रोक में दे हैव गिवन पर्टिकुलर लाइक आई हैव गिवन दिस पोजिशनिंग वाला थिंग. तो पोजिशनिंग मीन्स इट्स वेरी इंपॉर्टेंट इन स्ट्रोक. क्या होता है कि वे इन विच पोजिशन ए पर्सन इज कंफर्टेबल, what kind of support, जैसे हमें extra pillows we have to put in certain positions to help those people. They cannot do exercise just like that. Maybe they are completely paralyzed on one side and they are lying down. They need pillows, they need towels, they need lot of support, they need passive exercises at times. At times we have to, as therapists, move their hands and legs, so they can't move them on their own. So we should be knowing what position, how to do it, how to change it, and how it will vary from person to person, and what kind of stretching is required. Then how to increase the muscle mass increase करने के लिए we have to give them weight bearing activities. So what kind of weight, how much weight, when to increase, how much to increase. Even chest issues are there because their breathing muscles are not properly functioning. So how to work on them, how to be cognizant about the pain they are having and how that pain can be little bit reduced. Also they have speech issues, so speech therapist is required, and as I have already told, they get leakage in their bowel and bladder, so that issue, how that can be sorted with different practices. So for stroke rehab, a particular physiotherapist has to work with a yoga therapist, has to work with a speech therapist. So it's a combination of 2-3 therapists together if it actually a hard stroke has come to a person. Similarly, like in Parkinson also, like we have to see how to reduce the rigidity, how they can maintain little bit flexibility so that with support of their wheelchair or with support of their stick, they can go to washroom. They can do little bit of balancing. In Parkinson's, they tend to fall a lot, so because of fall, then they can have greater injuries. So we have to train them how to use wall, how to go, how to, even if they are getting up from bed, how to do that kind of thing, how to do different coordination kind of exercises. So chest expansion exercises has to be done. Because of the kyphosis, they feel a lot of pain in their upper back. So that has to be sorted out. Breathing exercises should be given so that their breath capacity increases and they feel some relaxation while breathing. Improvement in psychological well-being. Overall, they're very negative in thought, so we should give them. We have seen that, I read one research paper that kirtana helps a lot. Kirtana and chanting helps a lot in Parkinson patients. So we should give that, and we should try to make them engage with their family members, talk little bit, whatever they can, so that they feel happy on it. They are on the happy note in the complete process of treatment. Now we are starting with arthritis. Can anyone tell me which type of joints will tend to have arthritis? Arthritis means swelling, sujan, inflammation. Which type of joints?
fibrous,
Fibrous में होगा,
नो मैम साइनोवियल
साइनोवियल जॉइंट्स. ठीक है, जहां कहीं मूवमेंट होगी, देखो जहां मूवमेंट होगी वहीं पे तो इश्यू आया होगा. बाकी तो जो अपने फाइब्रस जॉइंट्स है, आपके सूचर्स है, वो मूव थोड़ी करते हैं, तो उनमें सूजन कैसे आएगी? जिसपे वेट बेयरिंग बहुत ज्यादा होगी, द थिंग विच हैज वर्कड, विच हैज डन अ लॉट ऑफ वर्क, दे आर साइनोवियल जॉइंट्स. तो साइनोवियल जॉइंट्स में जहां पे इन्फ्लेमेशन होती है वो आर्थराइटिस कहलाता है. ठीक है, मोस्टली जहां पे वेट बेयरिंग बहुत ज्यादा होती है उन जॉइंट्स में होता है. कैन समवन टेल मी वेट बेयरिंग जॉइंट्स कौन से होते हैं बॉडी में, जिनमें बहुत वेट आता है बॉडी का?
नी जॉइंट, हिप जॉइंट, एंकल जॉइंट.
वेरी गुड, वेरी गुड. सो जो नी जॉइंट है, हिप जॉइंट है, एंकल जॉइंट है, दे बेयर वेट ऑफ योर कंप्लीट बॉडी. So they tend to have lot of arthritis problems. But there are certain types of arthritis which attacks even the smaller joints due to certain other reasons. That is not only the weight is not only the reason in those cases. And in Bihar school book, they are saying that if it is diagnosed and worked on upon the right stage, complete reversal हो सकता है. सारा बिल्कुल arthritis ठीक हो सकता है 100% as per Bihar school and as per experiments and research papers as well, if the things are done in correct manner, correct fashion, and from the beginning itself. So how this arthritis comes into picture? Generally speaking, on broader side, what happens with age, blood supply to your synovial membrane reduces. अब जो साइनोवियल जॉइंट है वो एक मेम्ब्रेन के बीच में हमने देखा था जब हम जॉइंट्स पढ़ रहे थे. So there was a thick membrane. Inside that membrane there was synovial joint. Everything in our body needs blood supply. With age, what happens that blood supply gets reduced. Finally, the lubrication, जो साइनोवियल जॉइंट में अंदर जेली लाइक मटेरियल होता है जो उसको ल्यूब्रिकेट करता है, मतलब मॉइस्चराइज रखता है, तो उसका मॉइस्चराइजर जो है जिसको हम ल्यूब्रिकेशन बोलते हैं वो कम हो जाता है. Once that lubrication is reduced, what will happen? The lymph system will not work properly. वहां पे जो भी वेस्ट है वो लिम्फ से निकलेगा, लेकिन अभी ल्यूब्रिकेंट ही कम है, तो क्या होगा? एसिडिक वेस्ट जो बॉडी के है, जो मेटाबॉलिज्म वेस्ट है, दे गेट एक्यूमुलेटेड देयर, crystals get accumulated there, calcium gets accumulated there, uric acid crystals gets accumulated there. तो उन joints में वो accumulation हो जाती है. उससे क्या होती है? नर्व्स में इरिटेशन होती है एंड देन देयर इज पेन एंड स्टिफनेस. ऑल्सो द लाइनिंग ओवर योर जॉइंट्स, जॉइंट्स के ऊपर एक लाइनिंग होती है. जब ये ल्यूब्रिकेशन कम हो जाती है, द टू बोन्स दे स्टार्ट रबिंग ईच अदर. once the bones rub each other, then there can be loss of the, अगर हम दो चीजों को, दो सरफेसेस को हम एक दूसरे पे रब करेंगे, what will happen? उनका ऊपर वाला जो हिस्सा वो लूज हो जाएगा and there can be nerve roots can get exposed. तो nerve roots जब expose हो जाएंगे उसकी वजह से और पेन बढ़ेगा. Now, these are the types of arthritis, major types. There are many. Acute means which happens suddenly. Maybe has someone heard about that in chikungunya we get lot of joint pain? So even in viral, after viral, people tend flu, maybe there is a lot of pain, joint pain. So in those cases, there is inflammation in your joints. And that kind of arthritis is known as acute. But once the infection gets settled, after some rehab, after some proper nutrition, the things get back to normal within a month. Mostly within a month, things get normal. In certain cases, it persists. तो वो जो होता है उस टाइप ऑफ आर्थराइटिस को एक्यूट आर्थराइटिस बोलते हैं, which is for few weeks, which is due to certain infection or due to certain reason, which after that when the root cause gets sorted, after certain time, after few weeks, the arthritis problem also gets sorted. ठीक है, acute वो हो गया. Second is gout. Gout means this is a metabolism disorder. Metabolism of what? When we have a certain type of protein that is known as purine, then acid, a byproduct is getting generated. Make a note of it. It has come in exam. Uric acid. Okay. URIC ACID. Uric acid. जब प्यूरिन जो मेटाबोलाइज होते हैं, एक बाई प्रोडक्ट प्रोड्यूस होता है जिसको हम बोलते हैं यूरिक एसिड. When that uric acid is not getting properly processed by kidneys, it's not getting out properly from kidneys, at that time it gets accumulated in certain joints, that is known as gout. It mostly happens in your big toe. ये किसी भी बंदे के बिग टो, बड़ा जो पैर का बड़ा अंगूठा होता है उसमें फंस जाता है. And then the problem is known as gout. वहां पे inflammation हो जाती है, redness comes there, and this is very very painful kind of situation for that person. Person is not able to walk. It takes a lot of time till the uric acid problem gets sorted, then this gout can get sorted, but it can create permanent impact, permanent scars also on that particular joint. ठीक है, अगर gout का severe attack आया तो. And fructose is also a big reason for this. जो फ्रूट्स होते हैं, कोई बहुत मीठा खाता है, बहुत चीनी खाता है, अल्कोहल बहुत लेता है, they also tend to have high uric acid because they have this metabolism disorder. They cannot filter out uric acid. Ideally, they should be able to filter out, but maybe they are not having proper water. They are genetically prone to it. Then at that point, they can get gout. Another is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. यहाँ पे जो joint की lining है, synovial lining, that gets impaired. Your body thinks it's a foreign invader, we should attack it. Body tends to attack it, and it causes autoimmune arthritis known as rheumatoid arthritis. Majorly, it happens in women, mid-age women. It happens in small joints, but even big joints can get impacted here. Then this is osteoarthritis, which we were discussing, that excess weight की वजह से, age की वजह से, degeneration की वजह से होता है. That is osteoarthritis. It happens mostly after age of 50. It happens in those people who tend to have a lot of weight. It happens in those people who have high diabetes or who have high calorie food, who have excess calcium. Okay? Remember this. Even if a person is having excess calcium in their blood, that they tend to have this osteoarthritis because your milk, your calcium is acidic in nature. And then constipation is also one of the reasons as per yoga. Excess sugar, salt, milk, postural problem. Person who sits lot cross-legged. So what will happen in cross-leg position? Your ligaments will get stretched a lot. Your bones will tend to rub a little bit more than keeping them straight in a good posture. If excess of this posture is done, then also person tends to have osteoarthritis. Now, as per yoga, they are saying if there is some suppressed aggression or anger inside you, or some suppressed fear inside a person, which he is not able to express, it gets expressed through these pains and through this osteoarthritis thing, through the inflammation. And they say also rigidity and allergy, like the allergy at the other level, skin allergy and your nasal allergies, those people are also prone to have osteoarthritis. Even rigidity, they are saying at the mental level. If somebody is very rigid and fearful at mental level, they tend to get osteoarthritis and pain and bone issues in future. There are many types, more than this, but this is like major types. Okay? Rheumatoid C. This lining has got impaired. Then this is psoriatic arthritis. Psoriatic arthritis is again an autoimmune disease. What happens in this? Body attacks skin. Once it attacks skin, after that it starts attacking the joints as well. तो अंदर के छोटे छोटे joints भी attack होते हैं. Mostly it is in fingers and toes. It happens in small joints. Then gout, which we had discussed, uric acid वाले की वजह से, because of the metabolism issue. Septic arthritis is if some infection has happened, some septic has happened inside a joint, then that can affect a joint. Even injury can cause some kind of arthritis. Osteoarthritis is with age and degeneration. Juvenile idiopathic is like person will not know. It happens generally in kids. Juvenile matlab kids mein hota hai. Or idiopathic matlab you don't know the cause. So it happens maybe after a viral attack or something, or maybe they don't know, after some fever or something it happens. And this ankylosing spondylitis is when there is stiffness in the, it's actually a spondylitis kind of thing. So क्या हो जाता है इसमें, bamboo spine हो जाता है. The curvature of your spine, they get dissolved and your spine becomes stiff like a stick. Bamboo spine भी बोलते हैं इसको. ये भी autoimmune disorder है. ठीक है, it runs in families, happens generally in 30s, 20s or 30s. They need continuous exercise, otherwise they can get paralytic. And they need proper exercise. It's very painful condition, this bamboo spine. This RA, rheumatoid arthritis, which we had discussed also. See what happens. There's inflammation around this in this synovial membrane, and because of that there can be erosion of the bones as well. And this is symmetrical, मतलब यहाँ से भी हुआ, right side से भी उतना ही होगा, left side से भी उतना ही होगा. अगर यहाँ पे suppose left shoulder is involved, right shoulder will also be involved most of the cases. But in your osteoarthritis, there is degeneration of this surface. इस surface का degeneration होगा. यहाँ पे lubrication less होगा. Bone ends will rub over each other, and it is asymmetrical. If it happens in this hip, it is not necessary that it will happen in the opposite hip as well. ठीक है, तो कहीं पे भी हो सकता है. यहाँ जैसे इसको हिप में हुआ, फिर इस नी में हुआ, देन इस पे हाथ में हुआ, देन यहाँ neck में हुआ. It can happen in any part of any joint, whichever is the synovial joint, or which is even having some kind of moment in it. And the difference between these two is one more difference. Here, inflammation is more. Here, inflammation is less. It is there, though in the slide they have not written inflammation, but inflammation can be there in our osteoarthritis, but it is less. And morning stiffness here, it lasts more than 30 minutes. पूरे दिन उनको half day stiff ही लगता है rheumatoid arthritis वालों को. और जो osteoarthritis है, when they start in the morning, they start doing certain movement and all, 10, 15, 20 minutes में their stiffness gets sorted. So morning stiffness will not last more than 30 minutes in osteoarthritis. What practices we should do? We should do that diet which is not inflammatory. So we should increase water supply, because water intake, if they increase, their lubrication will be more in fruits, vegetables, and certain vitamin supplements, omega-3, that is very good. Loosening exercises they should do a lot. Sukshma vyayama unko karna chahiye. Their asanas should be very, very slow. And they should try to maintain it so that उनका muscle mass improve हो जाए. Once उनका muscle mass improve हो जाएगा, that will support the joint and the bones. एंड रिलैक्सेशन उनको बीच बीच में बहुत बार देना पड़ता है. वी शुड नॉट बी डूइंग a very third kind of dynamic kind of practice with them and then ask them to do shavasana in the end. Maybe we have to give them lot of relaxation postures or practices in between the practice, in between the asanas. So as per Bihar school, they are saying that they should do Pavan Muktasana one practices. They should soak their joints before doing the practice if the pain is more. They can also eventually, if it improves from Pavan Muktasana one, if their condition is in good, they are in good shape. After they can go into Pavanasana Muktasana two, that is Vajrasana, Shashankasana, Manjari Shashank Bhujang and Akarna Dhanur. But it is only if they are possible and which particular joint is impacted based on that. If a particular, suppose ankle is in bad shape, it has inflammation, then don't do certain kind of, then we can't do maybe Sashankasana or Vajrasana at that time. So person has to take call on that. Surya Namaskars, when they are completely done, we are okay with PM1 and PM2, then they can move to Surya Namaskar 6 to 12, but that depends on a condition. That depends if they are doing pretty well. Constipation is an issue because there are acidic waste, so we should do LSP and SP, they should do. Abdominal breathing they should do. Nadi Shuddhi definitely, that will balance, that will clear the nadis. Brastrika is very good for removing the waste and constipation ko hatane ke liye. In this, there is special mention of Antarmona stage 2 and 3. They are also saying that from Antarmona stage 2, go to 3, where a person is visualizing that he is expressing that deep and suppressed emotional conflict. वो कर रहा है, वो उसको दबा के अपने अंदर नहीं रख रहा है, is expressing it. Once that expression happens in the visualization, their deep fears, their deep angers will get sorted to a certain extent. And that will help them to heal little quickly. Yoga Nidra is good. They need deep relaxation. They need whole grains. They need light, good proteins like moong, lot of vegetables. But here, remember that they have written that lot of vegetables except onion. ठीक है. Onions and garlics were good for which disease? मैंने एक डिजीज में बोला था ऑनियन और गार्लिक खाना है. डू यू रिमेम्बर?
अस्थमा.
वेरी गुड. अस्थमा. ऑल योर लंग्स, ऑनियन और गार्लिक, हनी अपने लंग्स के लिए बहुत अच्छे होते हैं. यहाँ नहीं खाना है. और कोलेस्ट्रॉल के लिए भी गार्लिक इज गुड, बट यहाँ पे नहीं खाना है. ओके. Salads, they need to have seeds, fruits, except banana. They should not have banana. That is what they have written. Nuts and little honey is okay. Sugar, they should go off sugar, off milk, off refined products. That is, I think, common for every disease except barring one or two. And fast, they should do 1 day per week fast. They have also asked for a special practice of amaroli. That is having your urine 1 to 3 glasses. I don't know whether it actually works or not. I have not used it or not seen people using it, but maybe in ashram setting they are using it. And they say that has analgesic and impact, and there is research which supports that it is more beneficial than a steroid therapy. And there should be rest in between during inflammatory stages. I'll say there should be complete rest. There should be only very little exercise like light walking or light swimming they can do. Heat and massage is good for them if the inflammation is not there. Agar inflammation hai, then rice treatment. Rice matlab rest, ice, compression, elevation. But agar inflammation nahi hai, then heat and massage towards heart is good. Yoga Nidra and positive attitude. Now we'll go into back pain. Back matlab either your cervical or your upper back or your lower back or your tailbone. All that comes under जो spine का पूरा back होता है वो सारा मतलब back pain. ठीक है. Most things that causes issue in people, middle back doesn't cause that much problem nowadays because of computer and laptop. It is causing, but most of the cases we see cervical pain because your head has a lot of weight and your cervical region is short. It's not, if your proper posture is not maintained, it bears a lot of weight whole day. So cervical comes into a lot of strain. Also, your lumbar region comes into a lot of strain because of wrong postures, wrong exercises, wrong way of doing things, and even your stress. And then there is issues like ankylosing spondylitis, which is an autoimmune disease, which is also known as bamboo spine. Bamboo जैसी spine हो जाती है. Then there is spondylitis, spondylosis, spondylolisthesis, and there is disc prolapse. किसी को पता है disc prolapse क्या होता है?
हाँ, यस मैम।
बोलिए।
मैम, जो स्लिप डिस्क होती है उससे पहले वाली कंडीशन जो है उसको बोलते हैं, यानी कि जो बीच में जो चिपचिपा पदार्थ है गद्दी जैसा, वो थोड़ा सा निकलना शुरू हो जाता है बाहर।
वेरी गुड, हाँ बिल्कुल करेक्ट। और उसके बाद स्लिप डिस्क हो जाती है, तो हर्निएटेड डिस्क भी बोलते हैं इसको। बल्जिंग डिस्क पहले हो जाता है, फिर हर्निएटेड डिस्क होता है, फिर प्रोलैप्स होता है, और फिर बाद में वो पूरा मटेरियल बाहर ही निकल जाता है। जैसे इन्होंने बोला रुचि जी ने, देयर इज सॉफ्ट जेली लाइक मटेरियल बिटवीन टू वर्टेब्रा व्हिच इज नोन एज डिस्क दैट हैज अ वेरी सॉफ्ट न्यूक्लियस। if there is continuous strain, अगर उसमें strain होगा, proper spacing is not maintained, then due to that strain what happens, the nucleus starts bulging out, then there can be herniation, और बाहर निकलता है, और फिर prolapse हो जाता है, निकल जाता है बाहर की तरफ, और finally the entire disc can slip out of those two vertebrae. अगर पूरा स्लिप डिस्क हुआ है, then at that particular time there is complete rest required. उस टाइम हमें उनको एक्सरसाइज नहीं देनी है। तो बैक में भी डिफरेंट डिफरेंट जॉइंट्स है, डिफरेंट डिफरेंट इश्यूज है, सबके लिए सेम नहीं है। दो इन बुक्स दे राइट इट, बट इन रियल लाइफ इट डजंट हेल्प. We can't give same treatment to everybody. Everybody is different, every problem is different. So don't treat a condition, treat a person. जब भी आप एज ए फिजियोथेरेपिस्ट जाओ, देखो आप पर्सन को पूरा देखो, ऊपर से नीचे तक देखो, उसके कितने प्रॉब्लम्स है, क्या है, उनको समझो होलिस्टिकली, देन गिव अ सॉल्यूशन टू देम. डोंट जस्ट जंप इनटू दिस थिंग्स दैट कि ये बोल दिया है तो हम सबको बैक पेन वालों को सबको सीन देंगे. बहुत डिफरेंस है, किसकी कौन सी स्टेज है, किसकी डिस्क में कितना इशू है, कितना बाहर आया है. अगर नहीं पता चल रहा है, सेंड देम टू ए फिजियोथेरेपिस्ट, सेंड देम टू एन एक्सपर्ट. बट किसी की भी लाइफ में पेन मत लाइए. पेन अगर आप कम नहीं कर सकते, लाइए मत. दैट इज लाइक वन बेसिक फंडा. And then there is sciatica. Sciatica मतलब एक nerve होती है which starts from your lower back, runs through the back of your leg, back of your knee to your toe. So if there is some issue in your lower back, that nerve is getting pressed somehow due to osteophytes, जो bones में spur हो जाए या किसी herniated disc की वजह से हो जाए, if that gets pressed, then the entire region gets pain. It can happen only in the glutes, back part of your glute, or it can happen back part of the thigh, or it can happen till the knee or till the toe. So here also the root cause is lower back. So extra space जब lower back में आ जाएगी, sciatica problem खुद ही sort हो जाएगी. Sciatica is sort of a symptom, it's not a disease as such. अभी सर्वाइकल के लिए क्या बोला है बिहार स्कूल में? दे हैव सेड कि पवन मुक्तासन 1 करो, आप तितली आसन करो, एंड आप वो बोल रहे हैं स्कंद चक्र करो, शोल्डर सॉकेट रोटेशन करो, नेक का हल्का फुल्का साइड मूवमेंट्स करो, नेक का हाफ रोटेशन, नॉट फुल रोटेशन. आई डोंट नो वेदर दे आर लाइक नेक मूवमेंट बोला है उन्होंने नहीं बोला हाफ या फुल, बट आई थिंक we should do only half rotation. This they have mentioned that you should do neck rotation exercises very carefully. So with people who have cervical, don't give them full rotation. Rather in initial stages, don't give them rotation at all. Just neck के बाकी सब आप कर लो, side side कर लो, पीछे मत जाने दो उनको उतना ज्यादा. Just do it very gently, properly. Vajrasan, Shashank Asan, Shashank Bhujang, they are saying, Bhadrasan, Shavasana, Akarna Dhanur, Makrasan, Manjari Asan, Sarpasan, they are saying. But this also depends, varies from person to person कि उनका कौन से C1 से C7 तक कौन से vertebra में क्या problem है. So it entirely depends on that, whether we should tell them to look forward or whether we should tell them to look down or whether we should tell them to look up. मत्स्य आसना और सुप्त वज्रासना ये भी टोन करता है स्पाइन नर्व्स को, इसलिए अच्छा है, लेकिन सबके लिए अच्छा नहीं है. दिस इज माय पर्सनल एक्सपीरियंस एंड आई नो इट फॉर श्योर. बट आपको एग्जाम पर्सपेक्टिव से इसको याद रखो. मत्स्यासना, सुप्त वज्रासना टोन्स योर स्पाइन नर्व्स एंड इज गुड फॉर योर नेक एज पर बिहार स्कूल. And they are telling that they should be sitting in Padmasana and special meditative posture so that the posture gets improved, lengthening happens, and they know how to sit. That this is true. That they should know how to sit properly. If the posture is good, the cervical problem will get sorted. The neck should be ideally, as per allopathy as well, your neck should be on your spine. Neck should not be like कबूतर के जैसे neck बाहर protrude नहीं होनी चाहिए. Your neck should be on the spine back के ऊपर upper back के ऊपर होनी चाहिए. ठीक है. So there should be proper length maintained. प्राणायाम दे से नाड़ी शुद्धि विच इज ट्रू. मेडिटेशन है बोल रहे हैं कि हाँ कायास्थैर्यम करिए, आपको बैठना सीख जाओगे. So you'll know how to sit erect, how to lengthen, how to relax the compressed parts in your spine. Then Yoga Nindra, so definitely, but they are saying use a pillow, which is very necessary. Good, this is a good suggestion from them that during relaxation use a pillow, especially Yoga Nindra, because Yoga Nindra lamba hota hai, half an hour ka hota hai. If a pillow is not there, person will not be comfortable, especially cervical person. And Shat Karma will be Neti is very good for them because Neti से पूरा क्या हो जाता है, detox हो जाता है. तो Neti is good for all your back issues. In fact, Neti is good for most of the issues. जहाँ पे भी toxins का influence होता है body में, वहाँ पे Neti and other Shat Karmas are doing very good. Even LSP is very good for them. And additionally, they are saying if a collar is required, a doctor has given, it's very, very useful. They should wear it. Diet is, as for other arthritis, we have discussed the diet. For cervical also, they should have same kind of diet. I think ये देख लेते हैं, बस उसके बाद स्टॉप करेंगे. देखिए ये अपना हेड है, हेड के नीचे ये वाला अपना जॉइंट है, एटलस और ऑक्सीपिटल जॉइंट वाला. फिर उसके बाद यहाँ पे एटलस और ऑक्सीपिटल वाला. देखिए ये वाले डिफरेंट, ये जॉइंट्स का मेकअप इज डिफरेंट फॉर फ्रॉम दीज जॉइंट्स. These are known as ये facet joints है. यहाँ पे जो ये processes के बीच में joint है, this is facet joint. तो यहाँ पे भी अलग problem होगी, तो different kind of treatment needs to be done. Mostly these kind of issues, they face lot of pain. They face more pain compared to people who are having issues here. Even here, mostly the issues happen in your lower back. So here also issue can happen. Here also issue can happen. और ये जो बीच का एरिया है ना, ये व्हाइट कलर का, दिस इज योर डिस्क. यही पहले इसी का बीच का जो मटेरियल है वो बाहर निकलता है, थोड़ा सा पहले आगे निकलता है, फिर बाद में बाहर ही हो जाता है, और फिर ये डिस्क पीछे हो जाती है. एक डिस्क पीछे हो जाएगी, एक आगे हो जाएगी, जिसको स्लिप डिस्क बोलते हैं. और ये बीच का जो हिस्सा है, डिस्क जो है, वो बाहर निकल आएगी. ये वर्टेब्रा थोड़ा सा एक पीछे खिसकेगा, एक आगे खिसकेगा. हम इसीलिए बोलते हैं इसकी गैप कम हो गई है ना. और अगर यहाँ पे बोनी, इन ऑर्डर टू प्रिवेंट, यहाँ पे अगर इंजरी हो रही है कंटिन्यूअसली, तो क्या हो जाता है, बोनी स्पर्स बन जाते हैं. द बोनी प्रोजेक्शन, बॉडी इज वेरी वेरी इंटेलिजेंट. सो व्हाट इट ट्राइज टू प्रिवेंट एंड प्रोटेक्ट. इन ऑर्डर टू प्रिवेंट एंड प्रोटेक्ट, वो स्पर्स यहाँ पे एक्स्ट्रा बोन्स बन जाती है, सो दैट मोशन हम अपना रेजिस्ट करें. They don't want, they know that this motion, this particular posture is causing the issue. At that time, to prevent the joint and prevent the disc, the spur gets generated. यहाँ पे नहीं है वो spur, ऐसे spur मतलब थोड़ा सा यहाँ पे bony projections हो जाती है, यहाँ पे भी हो सकती है, ऐसे ऐसे थोड़े ऊपर की तरफ होती है. Tomorrow I'll show you one picture of bony projections. तो वो क्या करती है, बट इंटर्न वो क्या करती है, नर्व रूट्स को प्रेस करती है, नर्व रूट्स को प्रेस करती है, पर्सन इज नॉट एबल टू मूव प्रॉपर्ली. एट दैट टाइम इट गिविंग यू सिग्नल that restrict your motion in particular direction. Do it in the direction it's required. Work on the muscles, not on the joints completely at certain point of time. When there is inflammation in joints, it's better to work on the muscles surrounding them so that a support is reached to the joint. जैसे अब lower back में your glutes and your lower belly gives lot of support, a belt kind of support to your lower back. Rather than working on them, we just tend to work on the joints only. So अगर हम सिर्फ वो भुजंगासन करते रहेंगे for all kind of back pain, then there is no solution at all, and people will feel more worse rather than feeling good. So we should know what to do and when to do. So I'm stopping here. Tomorrow we'll continue this.